Hearty greetings from India. I am Dr. Somit, representing the Ayurveda Chikitsalayam and Research Institute, and I am here to speak to you in front of this august and learned gathering about Ayurvedic approach to ENT disorders and advances in research. As you all know, that Ayurveda is a living tradition of healthy living. Why it is a living tradition? Why? Because this tradition of knowledge is being examined in the light of new knowledge and revalidated through the tools of logic and critical rationality. And Ayurveda is an Indian heritage which is continuously evolving and creating a health tradition of regular updation. Thus, Ayurveda reveals an interesting journey from mythology to logic and then to rationality and embracing the precepts of evidence-based practice. The aim of Ayurveda is swasthasya swastharakshanam, that means keeping the people healthy. That means prevention is a primary goal of Ayurveda. And if at all people who do not follow the precepts of healthy living, we need to cure. That is vyadhyakanam vyadhi param mokshanam. You would be very surprised to know that Ayurveda is one of the most ancient science, and nearly 5,000 years back talked about 8 different specialty, namely Kaya Chikitsa, general medicine, pediatrics, Kaumar-Bhrita, surgery, Shalya Chikitsa, and ophthalmology, ENT, dysentery, dentistry called as Shalakya Tantra, which is the basic topic of our deliberation today. What is Shalakya Tantra? It's the branch of medicine in Ayurveda which deals with the diseases which affects the structure above the clavicle, the diseases which mainly affects ears, nose, mouth, eyes, head and throat. And you would be surprised that it was not just the medical treatment but also surgery which was a major part of intervention in these specialty. As you know, Ayurveda has been propounded as a whole system medicine. So I would like to just draw your attention as to what is whole system medicine. In this 6th slide, we see that any disorder is understood for a particular patient, whether a disorder related to internal medicine or Shalakya or ENT disorder, considering the genotype or prakriti of the patient, the phenotypic expression of the symptomatology which patient shows is vikriti or pathological stage of dosha imbalance, the tissue affected called as sara, the samanana and pramana, the physical build of the body of the patient, then the satmya, the geographic, ethnic, climatic and dietetic adaptability of the patient, the sattva, the psychiatric well-being of that patient, the ahara shakti or the metabolic or digestive well-being of that patient, vyayama shakti, exercise tolerance, vayaha or age. So these 10 factors are taken in account before doing any intervention or choice of medicine. It was one of the most ancient, early publication in 1977 which highlighted that Nimi was one of the most popular physician mentioned in all ancient texts, who has first classified different types of disorders of eye, ear, nose, throat or mouth. There are many texts in the public domain in Ayurveda which had specialized information about ENT disorders like Videha Tantra, Nimi Tantra, Kankayan Tantra, Gargaya Tantra and others. If you look at slide number 9, we see that there are specific guidelines to diagnose different disorders in Ayurveda, which comes under disorders of Karna called ear disorders, the Nasa Roga, the nose disorders, Mukha Roga, mouth and throat disorders. And over different span of time, there was addition and deletion of different disorders based on the relevance in that contemporary period. If we go to 10th slide, we see that there were host of medical conditions which was diagnosed in ear disorders like Karnashula, otolgia, Karnapranada, tinnitus, may be neurological or non-neurological, deafness, Badhirya, Otorrhea, Karnasrava, ear pertussis, Karnakandu, Karnagutha, conditions arising due to deposition of earwax, Karnapranada, tympanic perforation. They had methods to visualize tympanum and understand the condition of this condition. Then various infective suppurative pathologies like suppurative otitis, that is puti karna, and abscess, vidari, polyps of the ear, arches, tumors called arbuda. Similarly, if you go to realm of nose disorders, we found out different types of atopic rhinitis like apinasa, nasal herpes called as nasapaka, epistaxis called as shonita pitta, chronic rhinitis, puyasrava, and some of the neurological condition which gives burning sensation in the nose or inability to have sense of smell called deeptha. Also, they have document polyp of the nose called as nasha ursus and different tumors and edema. If you go in the realm of throat disorders, they were able to diagnose diphtheria, different types of diphtheria called as rohini. They talked about adenoids, kantash, shaluka, epiglottitis, atijihua, tumors of the throat in balaya, retropharyngeal abscess, sathagni, galavidradhi, galugha. Then also some of the neurological disorders like paralysis of the larynx called as swaragraha and malignant tumors like mamsasthana. They were even able to categorize goiters in name of galaganda and tonsillitis in name of thundikiri. It was not only diagnosis, but also they developed various indigenous methods and instrumentations to visualize, examine ear. Like in slide 13 you are seeing there is a visualizer of a scope which is put in the ears, and it is being perforated in the four organs to four sides to visualize any outgrowth or any foreign particles stuck in the ear canal. And also if you see a probe in the first picture called as karnashodhana to take out those foreign particles or deposits. If you see, there was a scope for also visualizing your throat, that is called as Kanta Anta Shalya Vulokani Nadi in slide number 14. In slide number 15 you see there was also a nasal speculum to visualize different types of polyps and different tumors in the nasal cavity and take out these foreign particle or tuber or these through shalaka or through specific nasharbud shalaka. These are the other kinds of various instruments like shalaka and the forces being used in that era. Then there was also, as we know, that the major drug delivery system in ear and nose disorder were either through vapors or medicated fumes, or by aerosol or by spray of medicated powder or herbal compound. So this is called as dhuma yantra, where the medicated vapors were made and were given to these areas so that it can irrigate those areas, improve the vascular circulation and lymphatic drainage to create a activity. Then it was also Sushruta in 6th century BC, where he practiced reconstruction of nose and ears. As we talked, that it's also Ayurveda is a preventive science. It has propounded various preventive measures like nasya, nasal insufflation with various powder, aqueous extracts, lipid excipients to improve the blood circulation, peripheral circulation and lymphatic drainage and propel metabolism and promote metabolism. Similarly in Karna Purana, which is also a withholding of oil in the ear, which may be a oil, it may be to improve the ear hygiene, nose hygiene, and then prevent bacterial development, growth. Similarly, Karnadhupana, as we talked about the volatile principles or fumes which basically are installed into this nasal or auditory cavity, seeing that it is improving the vascular drainage and improve the immunity of these canals. There are also procedures like Shirodhara and Shirovasti, which is very effective neurological disorders, ENT disorder. Similarly, Tarpana and Swedana is also very good for neurological as well as circulatory disorders, infective disorders of ENT. As we all know, that whole world is transforming towards evidence-based practice, and Ayurveda has also started taking note and creating evidence on PubMed index journals. I thus want to quote few PubMed index studies like response of Ayurvedic therapy in treatment of migraine without auras, then efficacy of ginger in migraine headaches, which is said to have a very effective anti-inflammatory activity. We have also seen that there are a lot of evidence coming up in Ayurveda, which was studied in an Italian cohort of pediatric headache patients, where they found it to be quite effective in the headache in pediatric population. There was also a study done from Calotropis gigantica, which is called as arca, which has been processed in oil or lipid excipient, which was used for treating automycosis, karnasrava, according to Ayurveda. There's also a clinical study which has been done on chara, which is a water alkaline principle extracted from a plant, which is used on this hypertrophied mucosal thickening, creating nasal discharge and obstruction, and which is found to be very effective. Then there are a host of Ayurvedic herbs like Phyllanthus emblica, Gingiber officinale, Terminalia cebula, Terminalia bilerica, Piper longum, having a potent antistomach, antispasmodic, mast cell stabilizing activity, which shows that many of the allergic autoimmune responses can be modulated through our Ayurvedic herbs. There are also immunomodulatory effect of Sirisha, the compound like Alpizia libac, and also there is a host of plants like Castia fistula, which is used in external otitis infection, where they are found to be very effective in strains of Streptococcus aureus. There is also Terminalia cebula, which is effective in antimicrobial activity of ear pathogens. There are also immunomodulatory effect of various Ayurvedic compounds like Vyastha yoga in children suffering from running nose, short throat, nasal obstruction, and enlarged tonsils. So there are enough growing evidence of efficacy of Ayurvedic medicine in public domain, and especially in high impact journals. So we are moving towards evidence-based practice in Ayurveda, and what we require at this point of time is an integrative approach to management of ENT disorders. And I'm very thankful for the organization to give me an opportunity to interact with you through this video, and I would be open to any questions subsequently on Skype. Thank you one and all for giving an opportunity to talk to you.